Okay, we're going to do some trach care on Mrs. Smith here. Before going into the patient's room, I made sure I gathered my supplies. I got my trach care cleaning kit, a sterile suction kit, a suction canister, a trach mask, a resuscitation bag, and any PPE that's not in the room, like maybe a face mask. So, and some sterile saline syringes. So upon entering, knock knock. Hi, Mrs. Smith. My name's Kate. I'm from the respiratory department here at the hospital. We're going to do some trach care, okay? Great. This should at least be done twice a day, so we need to communicate with the nurses when it's getting done. So, first thing I'm going to go ahead and do is assess my patient. I'll wash my hands, put on some gloves. Mrs. Smith, can I go ahead and listen to some breath sounds here and make sure you're moving air properly? Check your SpO2, heart rate, respiratory rate. I'm also going to check this cuff pressure here on her trach and making sure it's between 20 and 30 centimeters of H2O. So next thing we're going to do is go ahead and set up a suction canister on the wall, and then we can go ahead and do the sterile suctioning. I'm going to go ahead and open up my sterile suctioning kit. We can hyperoxygenate my patient while I'm doing this. I'm going to put on my left hand first. That'll be my clean hand. My right hand is going to be my sterile hand. And then we'll go ahead and with my right hand grab the suction catheter, so it's always in the sterile hand. I'm going to put some lube on my right hand and make sure I hook the suction catheter up to the wall. So go ahead and run my hand through that lubrication. And Mrs. Smith, we're just going to go ahead and suction in out. I'm going to go ahead and insert. Once I feel the resistance, pull back a bit and go ahead and include the thumb port. Suctioning out my patient. Go ahead and oxygenate her again. We need now that we're done with the suction, sterile suction, we can go ahead and start the trach care. Go ahead and, oops, lay this out. I'm going to remove the inner cannula first. If it's a disposable one, we could go ahead and toss it. If not, there's different types of trachs. So in our kit, there's pipettes, and we have the sterile saline. We can go ahead and clean it if we needed to. And we'll go ahead, there's also some gauze. We can lay it out and let it air dry while we clean the stoma site. So now I can go ahead and untie Mrs. Smith here. I'm going to take out this old gauze. And I'm going to secure the trach in place. And from the inner part, and with one swipe going out, dispose of each Q-tip while I clean that. While I'm cleaning, I'm going to go ahead and examine the stoma site itself, making sure there's no foul smell, excessive drainage, or pink or tenderness or of any sort. I'll go ahead and do both sides, and I can make sure it's dry, and we'll put on a new gauze or foam pad. We can secure a new trach collar on her, and then we'll go ahead and insert either the old inner cannula or a new inner cannula. With our patients, our trach patients, we always want to make sure that we do have a spare inner cannula of a smaller size in there, just in case there's any inflammation or change in anatomy for the patient. So we do have, we're going to check our patient as well, make sure that cuff pressure is in between 20 and 30. And now that her trach is secure and cleaned, I'm going to assess my patient again, listening to her breath sounds, checking that cuff pressure, making sure that my patient is comfortable, bed's low locked, she has her call light, and go ahead and communicate with the nursing staff that trach care was done. And that's it.